Hi everyone, I'm Dr. Mache Seibel, and I want to talk to you about something I talk about with my menopausal patients routinely and that you may not be aware of, and that is, as a woman, you are more at risk of dying of a heart attack than your male counterpart. Can you imagine? Most people think that heart disease is, the picture of the guy with pain in his left arm or his right arm and crushing chest pain. But women are actually 52% of the heart disease, of the 80 million Americans that have heart disease, and of the 860,000 people that died from a heart disease and a heart attack, 52% are women. So they're more than half of all those conditions. Now here's what you need to know about the symptoms of heart attack in women. First of all, they're so general, so non-specific. That's the problem. The symptoms may be pain in the neck, pain in the jaw, or the angle of the jaw. It may be upper abdominal pain. It may just be lightheadedness. It could be just dizziness or fainting. Or it could be something called malaise, just a general feeling of discomfort. You just don't feel good. So these are so non-specific. It could be the flu. It could be almost anything. But remember, one of the possibilities is it could be a heart attack, and that's why you should call 911 if you start to have a cluster of these symptoms. Now, men, on the other hand, are much more likely to have that crushing chest pain I talked about, pain that radiates down their arm, mostly the left, but could be the right arm. They could be having a sense of doom, cold sweats, shortness of breath. Those are much more common with men, although they could occur in women. Whereas, as I mentioned, women are more likely to have the pain in the angle of the jaw, in the neck, or in the upper abdomen, a sense of nausea, sick in the stomach. They may have lightheadedness. They may have dizziness or fainting, or this general feeling of discomfort. So if you are a woman, particularly if you're a woman in your 50s or in menopause, and you start to have those symptoms, don't be afraid to call 911. It could save your life. That's one of the reasons that in a book I co-wrote with Shelley Glazier, it's called Save Your Life: What to Do in a Medical Emergency, which is available on Amazon and online stores around that you can check on. You will find more information on heart disease and tips on other medical emergencies that could save your life. Well, I hope this has been helpful to you. Check out the book. Remember these symptoms, and remember, it's better to stay well than to get well.